Right now, it's important that we review the divisions of the autonomic nervous system in order to get a really good understanding of our medications and how they work on the autonomic nervous system. We really have to have a good feel for both the sympathetic nervous system and the parasympathetic nervous system. One of the easiest things about that whole process is that the autonomic nervous system, those two portions of the autonomic nervous system, pretty much have opposite actions. And if you spend some time just logically thinking about it, you can pretty much predict what those actions are. So for instance, the sympathetic nervous system is the fight or flight response. And the easiest way to really get a good feel for that system is to think about what would happen in each of the organs if a person was, for instance, being chased by a bear. If you've ever had a really frightening experience, you would have noticed a few things straight away. And put yourself back into that position. What did you notice with respect to your breathing? You started breathing so quickly, so heavily, that your chest felt like it was almost about to explode. So the sympathetic nervous system increases the diameter of the airways in the lungs. What did you notice happen to your heart? And that's another thing that contributes to those sensations of the chest, because your heart was beating so hard and so fast that it felt like it was almost out of control. How did your mouth feel in that really, really intense sympathetic nervous system rush? Your mouth was so dry that you almost couldn't swallow. But at the same time, that type of thing is happening all the way through the gastrointestinal tract. There's a decrease in secretions nearly all through the GIT, decreased motility, and that's because in a life or death situation, you don't need to be spending the energy digesting food. And let's just try to figure out some other things that would be happening just using logic. If you're trying to save all of the blood for your heart, lungs, brain, and the big muscles so that you can get away from whatever's chasing you, what is going to happen to the blood vessels of what we call the periphery? The periphery is the GIT, the skin, the extremities. All of that is called the periphery. What would you think would happen to those blood vessels? Would you think that they would dilate, they would constrict, or they'd stay the same? Well, in a severe sympathetic nervous system response, the blood vessels of the periphery are all going to constrict. Most of the blood vessels in the body are going to be constricting when you're running away, and that combined with the increase in heart rate and increase in contractility is going to send the blood pressure skyrocketing. And what do you think would happen to the urinary sphincters that allow urination to occur? And those would be constricting as well. You need to flee, not pee. And what do you think would happen to the pupils of the eye? We're running away so fast, we need all the light possible. So are they going to constrict or dilate? And yes, there's a dilation of the pupils in the eye with a sympathetic nervous system response. We want as much light coming in as possible. And finally, there's another few organs that would be affected. For instance, we would need to do everything possible to make glucose, save glucose, and so forth, so that the energy is there for the brain and the muscles, and therefore there's going to be an effect on the liver as well. So you can see that a drug that affects the sympathetic nervous system is going to have multiple effects all the way through the body. And all you need to do to remember those effects is to think about the fight or flight response and apply that logically to what would happen to each of those organs. With respect to the other portion of the autonomic nervous system, the parasympathetic nervous system, remember that in most instances it'll be the opposite effect. And why is that? Well, the autonomic nervous system is part of the way that we maintain homeostasis, that equilibrium that we maintain in the body. We use the autonomic nervous system to fine-tune those organs to meet the needs at the time, to maintain homeostasis. So the parasympathetic nervous system, what's that going to do to the heart? Think about the last time that you were able to rest and relax, if you can remember. There was a decrease in heart rate, a decrease in contractility. There's a relaxation of the muscles. It's the rest and digest system. It increases all of the activity of the GIT, including the secretions into the GIT and the movement of the GIT. In a restful state, we don't need much light coming into the eye, so we constrict the pupils of the eye, and there's also an increase in urination or ability to urinate and an increase in defecation. So the parasympathetic nervous system is virtually opposite of the sympathetic nervous system, but there are a few exceptions. The parasympathetic nervous system doesn't actually dilate the blood vessels of the periphery. Recall that the sympathetic nervous system constricted those blood vessels. Well, what occurs in the parasympathetic nervous system is that there's a lack of constriction, and that relaxes the blood vessels and gives that lower blood pressure that's seen with a parasympathetic nervous system response. And hopefully you've got a good, clear picture of what happens to each one of those organs in a fight or flight response. Just think about it logically and try to remember each one of those organs that we just went through.